Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
All of the following are advantages of using raloxifene over estrogen in postmenopausal women except raloxifene. All of the following are advantages of using raloxifene over estrogen in postmenopausal women. This raloxifene reduces the fracture rates. True. It avoids endometrial hyperplasia. True. It reduces the incidence of venous thrombosis. No, it does not change the incidence of venous thrombosis. It has no increase in incidence of breast carcinoma. True. It can increase. There is no effect on venous thrombosis. Then 45-year-old female is suffering from severe menorrhagia and underwent hysterectomy. She wishes to take hormone replacement therapy. The physical examination and the breast are normal. X-ray shows osteoporosis. The treatment of choice for this X-ray shows osteoporosis, and she is 48 years on hormone replacement therapy after hysterectomy. So it is, you should give the patient estrogen should be given to the patient to counteract with osteoporosis.
Thank you and thank you for watching.